Hi everybody, this is Rich Sanders and welcome to the first Health Law Nugget 2018. Today is February 6th and we're reporting on two important news stories from the past week in healthcare law. I hope you'll enjoy this series of Health Law Nuggets as we produce them in the coming year for busy folks in healthcare who don't have time to read the stack of trade magazines on their desk or check the ocean of emails that flood their inboxes. This is just a distillation of a couple of important points for healthcare law for the past week, and hopefully in a format that you find useful and entertaining. So our first story comes to us from Wall Street, which took a real beating yesterday, but is not reflected in the health law news from last week. On January 30th, Warren Buffett announced that on behalf of Berkshire Hathaway, Amazon, and JP Morgan, those three companies were forming a joint venture to try and control the costs of the employees of their combined organizations and their dependents. Now, even though it's just three companies, these are massive organizations that affect not just Wall Street, but really, I think, may be a bellwether of things to come in terms of corporate America trying to manage and control its costs. Between the three companies, they have over 1 million employees, according to the CEO of Amazon. And Warren Buffett said the reason that they're trying to put this venture together is to get a handle on the ballooning costs of healthcare for their organizations. This is an ironic development, everybody, because it was just this time, February of 2009, after President Obama and his administration had worked with Congress to get the stimulus bill passed, that companies started coming to the White House and saying, we've got to do something to control the costs of healthcare in corporate America. 9 years later, and billions of dollars being spent on the PACA, companies are still efforting to do the same thing. So this is a non-legislative approach to a market condition that we should all keep an eye on going forward. The other big story out of Washington this week on February 1st, CMS introduced its proposed rule for compensation for Medicare Advantage plans. It's not necessarily a significant increase, 1.84% to take effect in fiscal year 2019, October of 2018. But it's two important trends to note for those who are watching the development of Medicare policy in the U.S. The first is that Medicare Advantage plans now ultimately account for 20 million Americans. That trend of Medicare Advantage enrollment keeps going up year after year. As the baby boomers age and become more enrolled in Medicare, so grows the popularity of Medicare Advantage plans. The other thing is something that's important not just for those who are in healthcare and participants in the industry, hospital administrators, physicians, practice managers, pharmaceutical executives. This is important to note because Medicare Advantage is becoming an increasingly important player in the whole healthcare industry. But for those of us who are in the age where our parents are becoming baby boomers, are becoming Medicare enrollees, or we are becoming Medicare enrollees, it's noteworthy that Medicare Advantage is starting to expand the covered range of services that it provides. This proposed rule covers things like daily maintenance, in-home care by non-skilled nursing providers, and other types of services that have not traditionally been part of Medicare. It's a sign not just of the popularity, but the demand for retirees as they grow older to get non-healthcare services covered by Medicare, and something to watch out for. Thanks for watching this Health Law Nugget for February 6th, 2018. We look forward to seeing you all next week.